Good evening, ladies and gentlemen. I am Sam Baydoun, and I proudly serve the city of Dearborn and Allen Park on the Wayne County Commission. This evening, we are here to discuss the COVID-19 pandemic that's sweeping our country and the entire world. COVID-19, or the coronavirus, is a dangerous virus that is being spread rapidly from one city to another, here and all over the world. Now it's here in the US with more than 4,000 cases, and it's causing fear and panic. We are here this evening to get answers from our Congresswoman Dingell, who will be joining us by phone, and from our Wayne County representatives Assad Turfe. To my left, Assad is the Chief of Staff for the Executive Mr. Warren Evans. Assad has 18 years of law enforcement and experience in dealing with crisis situation. And also to my right, Mr. Sergio Dinaro, the Director of Emergency Preparedness in the Wayne County Health Department, and internal medicine and also internal medicine physician, Dr.Belal Abdallah. He is also the Chief Medical Officer for Long-Term Care at Beaumont Hospital. Ladies and gentlemen, as we face this crisis, we must all come together as a nation and fight this pandemic, just like we came together after the attacks on 9/11. Earlier today, Governor Gretchen Whitmer signed an executive order which temporarily closes restaurants, bars, casinos, cafes, which also include hookah bars. It allows for restaurants to do carry-out, walk-in, or drive-through orders. Our main goal is to flatten the curve, and we will be talking about the curve here with our distinguished panel. And we do that by following the CDC guidelines, the directions of our federal, state, and local governments. On our panel today, we will answer the questions that you have submitted, and we will learn how we can all do our part as citizens to defeat this major health crisis. Also, I would like to mention that Dearborn Public Schools is offering free breakfast and lunch meals to all children under 18 in 6 different locations throughout the city of Dearborn. The locations are Fortson High School, Dearborn High, Salina Intermediate, McCullough Eunice, Woodworth, and Etzel Ford. The meals can be picked up anytime between 10 a.m. until 12 noon, starting tomorrow, Tuesday, March 17th. We will begin our program tonight with a presentation from Mr. Sergio Dinaro from the Wayne County Health Department. Sergio, it's all yours. Take it.
Good evening. Thank you. So we'll be discussing the Wayne County emergency preparedness response to the COVID-19 pandemic. Again, my name is Sergio Dinaro. I'm the Emergency Preparedness Director for Wayne County, and I'm going to give you a quick summary of what coronavirus is and what we're doing to combat the coronavirus. So before we get into this, I'd like to discuss a little bit about what coronavirus is. The coronavirus is actually a family of viruses. So the term is thrown around a lot on the news, and really the coronaviruses are responsible for a lot of different illnesses, from very mild illnesses like the common cold. There's 4 strains of coronavirus that cause the common cold, up through more severe illnesses such as SARS and MERS are both caused by the coronavirus. The current COVID-19 is a mutation of that virus that has now caused this new disease. The COVID-19 name comes from coronavirus disease. It's an acronym, and it was first discovered in 2019, so that's where the name comes from. So in Wayne County, these numbers are as of this morning. We currently have 13 confirmed cases and 0 deaths. So who is at risk for coronavirus and COVID-19? So emergency preparedness has been tracking the COVID-19 disease since January 20th, when China sort of announced it to the world. So EP, emergency preparedness, spends a lot of time trying to identify what is the threat from COVID-19. So I've posted some statistics here. Some of the pertinent statistics to keep in mind are that 80% of the deaths from COVID-19 are in people 60 years old or older, and 75% of the deaths are from people who had pre-existing conditions. Either their immune system was weakened or they had a respiratory problem. So a couple of facts. COVID-19 spreads at twice the rate of the flu, and there's currently an average death rate of 3.4 versus 0.13 for influenza. You've probably heard these terms thrown around a lot in the news. Some things to keep in mind, though, are a lot of the cases of COVID-19 are actually not known about yet. So worldwide, there are a lot more cases than we're aware of because testing for COVID-19 has been very slow. As we catch up with the testing, the death rate number should actually look a lot lower in the end. Also, the COVID-19 disease is spreading very quickly through society because we don't have something called herd immunity, which is an element of the population that has immunity to that disease. Right now, everyone is susceptible, and so it spreads very quickly. So here's a breakdown of the risk by age category. So as you can see, all the way up to 49 years old, the probability of dying if infected is 0.2. Then it goes up from there. As you can see, at 80 plus years old, the probability of dying is 14.8. This leads us into my next point. I'm sorry, actually, there's also some statistics as far as pre-existing conditions and death rate. These two things combined, the pre-existing conditions, keeping that in mind, and the average age of people who develop those more severe symptoms, leads me to my next point, which is what is Wayne County Emergency Preparedness doing to help prepare the community for this? So before I get into that, I'm going to reiterate what you've seen on the CDC, because this truly is the most important aspect. Wash your hands often for at least 20 seconds. If you can't wash your hands, use a hand sanitizer. Cover your coughs and sneezes with a tissue or your sleeve. We like to say, do the cough dab. Wash your hands often, because that is the most important thing. And yes, I'm going to keep repeating it. Stay at home when you're sick. I'm sorry, you can back up. Wash your hands often and try to avoid touching your eyes, nose, and mouth. Go ahead. So the two big things that emergency preparedness are working on right now is number one is a public awareness campaign. Right now, there are no medical countermeasures for COVID-19. There's no vaccine that's being worked on, and there's no antiviral drugs that will treat COVID-19. That means the only way that we can combat this is through public awareness of those things that I mentioned before. Wash your hands, stay home from work if you're sick, and wash your hands. And I would also like to mention that we do have an information line set up for the residents who would like to get more information. The information line number is 734-287-7870. That is Monday through Friday from 8 to 5. And of course, you can call 211 for information 24 hours a day. And the last thing I'd like to talk about is these non-pharmaceutical interventions. So other than getting information out to the public on what to do, these non-pharmaceutical interventions are what you've seen coming from the governor, from the president, the social distancing, closing down restaurants. These are non-medicational ways that we can do what we like to call slow the spread. That's the most important thing. That's how we're going to attack this disease, is by slowing down that spread or flattening the curve. So, next. So with that, I don't want to take up too much time. So,
Okay. So Congresswoman Dingell is not on the phone yet. I know that she's supposed to be on a conference call. She's very busy with the governor and other elected officials. Dr. Abdallah, is there a vaccine, drug, or treatment for coronavirus?
Unfortunately, at the present time, there is no vaccine, and there is no drug treatment specifically for the coronavirus, the COVID-19. So where it stands is once someone is infected, that person is depending on their own immune system to fight off this coronavirus 19. The good news is 80% of people who get infected by COVID-19 will have just mild symptoms, and they will recover just like they would recover from a common cold. So 80% of people will recover completely and within a few days. What's important is when you do become infected, you're going to have mild symptoms. So you'll have, and the common symptoms are a dry cough, a fever, and tiredness. Tiredness meaning, you get a little short of breath if you climb one flight of stairs, or you just feel fatigued and you sometimes can't catch your breath if you do things with a little more activity than you would. So if you have those three symptoms, then you most likely in this period of time have the COVID-19 infection. And what I'm recommending to all my patients and to everyone out there is if you do have these symptoms, is to treat them like a common cold. However, the only difference is I want you to stay home for 14 days and self-quarantine. This is the big difference here between the coronaviruses that Sergio was mentioning, the common cold coronaviruses, and this COVID-19. And he also mentioned that we don't have herd immunity, which means that none of us are immune to this vaccine, to this virus as of yet. So until you catch a virus, you're not going to become immune to it until you go through the illness. So once you become immune to it, then you're okay. However, you don't want to spread it to the next person, and that's why we're recommending a 14-day self-quarantine when you have these symptoms.
Dr. Abdallah, I think you're leading me to the next question, and this question for both of you. Everybody is talking about flattening the curve. Is that one of the reasons why we tell people to stay home for 14 days so we don't repeat what happened in Italy? Because in Italy they were not prepared.
Yes, absolutely, and Sergio touched on this also. So what happens is when the virus comes through a community, like it has now, it is here, again, no one is immune to it. So everyone that is exposed to the virus will get the infection. So there's no way that you're gonna be exposed and you're not gonna get sick. Mild sick, just like a cold, but you don't have the immunity to stop it. So what happens if you don't self-quarantine, then the next person that you touch, if you have the virus on your hands, for example, or if you cough and sneeze near them, that person will also get infected. And if everyone gets infected at the same time, this is what we call the surge. So if you have a population of, let's say, a couple 100,000, and everyone starts to get infected because they're not self-quarantining, then you get the big surge where that's the curve that goes up. With quarantine, you'll prevent this surge. And you'll flatten it to where everyone will eventually, not eventually everyone will get sick. Some people will get away from it. But they will be getting sick at a very much slower pace. And the number of people will be at a slower pace. And the reason that's important is the healthcare system at the present time, anywhere in the world, can't handle such a surge. That's the important point about this.
Is COVID-19 the same as SARS? Is it the same as SARS that we had before?
No, it's not. So it comes from the same family, the coronavirus family. So as Sergio mentioned earlier in his presentation, the coronaviruses are a family that cause illnesses from mild illnesses like the common cold. 4 coronaviruses, 4 different ones will cause a common cold. And then you have severe illness that can come from SARS and also the MERS, the Middle East Respiratory Syndrome. But those haven't penetrated outside of local areas, and we haven't really seen a SARS, I believe, since 2003. So,
Doctor, this question is for you or to Sergio. How long, this is one of the questions that we received, how long does the COVID-19 stay on the surfaces? If this table is, it's got the COVID-19 on it, does it stay for how long? One day, 2 days?
Yeah, that's a great question. So it can last on different surfaces from anywhere from a few hours to a few days. So there's some different variables. So for example, depending on the temperature, depending on the type of surface, So it can be a few hours. Metal surfaces is where it lasts the longest, for a few days. So metal surfaces like door handles, doorknobs, it can last for a few days. So that's why, again, we stress, wash your hands for 20 seconds with, scrub them with soap for 20 seconds. Those are because you really can't get through your day without touching a surface. So when you're in public, you come home, or even, whenever you get a chance, an opportunity, after you touch a doorknob, go wash your hands or use hand sanitizer so that you can get rid of that virus from your hands.
Sergio, how long is the incubation period for COVID-19? We had this question. I don't know if it was in the presentation. I think you touched on it in the presentation.
So the incubation period is that period of time from when you're exposed to the virus to the point where you start to develop those symptoms. And right now it ranges widely, so it's generally between 2 to 14 days with an average of about 10 days. So most people who are exposed on average will start to show symptoms about 10 days later.
Okay. We'll come back to some of these questions. Now I want to turn to my friend Assad Turfe, the Chief of Staff. Assad, you have experience in dealing in crisis management, and I'm going to ask you straight out. Assad, are we in a crisis?
Yes, we are. But it's clearly it's a crisis, but it's a manageable one. And in many crisis situations, people look to government and public officials, law enforcement officers, to deal with a crisis situation. Here you have the government stepping in and doing things, but it can't be just the government. People, humans need to get together and really try to do everything they can to manage this. And, for instance, like the doctor mentioned about, touching hard surfaces. Right now we have a lot of people running to the grocery stores. And what's at the grocery stores? The carts. The carts are the metal surfaces, Think about those things when you go to the grocery store. There's going to be a lot of people there. What can we do as human beings right now? One is, when we looked at those rates, those numbers, where it's 14-50% was for people over 80, So if you have elderly parents, elderly grandparents, other family members, make sure that you're also protecting them. And, when you go out in public and, you encounter with, stuff like that, before you come home, wash your hands and go with them. But the most important thing about the supermarkets, right now everybody's running to the supermarkets. But understand this, we don't have a shortage of food. In the United States, we feed the world. We have more food in this country than anywhere. We feed the world. There isn't a shortage.
Good to know.
Now, if the shelves are low, they're low because we can't stock the stock market. The grocery stores can't keep them stocked enough. But if you give them a couple of days, and the next day they'll be restocked. But that's what's causing, I think, a lot of the panic right now. Is people are running to the grocery stores and they're buying 40 cases of water. They're buying 20 loaves of bread. That's what's happening. It's people that are overreacting that are causing fear. And understand the measures that government has put in place right now, they put these measures in place to protect the public. And it doesn't mean this situation is going to get worse before it gets better. But in the meantime, the key thing is we just got to keep the social distancing. I know as respectful individuals, we greet individuals, right? We greet, we hug, we got to stay away from that, Even the elbow thing, we got to avoid that, Avoid the contacts, avoid the slow contacts, and when you get home, I've advised my parents not to leave, just stay home. If there's anything I could do as their son, I'm going to go do it for them. I'm going to go do their shopping. I'm going to do their cleaning. And I think right now we really have to focus on, assuming, that everyone could be potentially sick. And we just got to be able to do it enough and long enough to be able to curve and flatten the curve like the doc and Sergio were mentioning.
Assad, can you touch a little bit on what the Wayne County government made a decision yesterday, I believe, to shut down, like the Wayne County Commission now is shut down for a couple of weeks.
Yeah.
And the staff in your administration and the Wayne County Executive's Office also, what can you share with the public about what the county is doing to protect its residents?
Yeah. So on Friday we made a decision at the county that we got to start thinking about essential staff and non-essential staff and what's important, and we want to make sure that we keep government services, we got to make sure we keep government services going. And in a situation where you start having essential staff get sick, that, the potential that could be a problem for governments. So we want to ensure that we're keeping our staff safe. So anyone that doesn't need to be there, doesn't have to be there, shouldn't be there. And that's kind of the thought process that we had. And we want to also protect the constituents that we serve, and, we want to try to, honestly, we're trying to lower human interaction. I mean, that's the key here. There's a reason why these, the restaurants and, the bars and the casinos are closing down. It's to limit human interactions, and that's what we got to do here, and that's the thought process is. And we're looking at every single opportunity, and we're learning something every day. This is something that is something that's the first time it's ever happened in my lifetime, and I think in everybody that's on earth, it's the first time in their lifetime I think we're seeing something like this. So we just got to give it some time, and I think with time things will get better.
If things get worse, Assad, do you think that the government would institute like a national curfew where for 2 weeks we have to stay home in order to flatten the curve? Do you see that as a possibility?
I think that's a possibility. I think in places where they were able to flatten the curve, they took serious measures. I mean,
like in China.
In China, yeah. The best measure to get this done is going to be to pretty much lock everything down. I mean, you got to keep everyone home. That's it. But that's something that's going to be up to the president to make it. I'm not the president of the United States of America. Well, not just yet. So.
Yeah. But to our community, Assad, as you can see, there's a lot of fear and panic out there. Yesterday, I went to Costco. I bought some daily essentials. And I like the fact that Costco has a limit per member as to how many cases of water you can buy. But our community here in this area, they're overreacting, or is that a normal thing to do?
No, they're overreacting. There's no need for that. I mean, there's going to be still water there next week, and there's going to be bread, and it's all there. It's clearly an overreacting, and people are just they're afraid, and that's what people do when they're afraid. They overreact. The truth of the matter is, we just, we got to remain calm, and we got to understand that we're going to get through this. We got through 9/11. 9/11, September 9/11, 2001. Everybody woke up in the morning, and we were under attack. Everybody was afraid, But through time, we get better, and maybe this is a new norm for us. Maybe we don't handshake no more. I don't know, but we adjust. We adjust as humans, and we live our lives. We still have to get up in the morning and do what we have to do. But I have no doubt we're going to get through this, and and with the warmer weather around the corner, I think I think within 8 weeks we're going to start seeing. But I'm not, the experts have saying with warmer weather, hopefully we could flatten the curve, and that's what we got to do. We got to flatten the curve, and from there, I think things will start to turn.
Yeah, and that's an important point you just made about warmer weather. Now, we don't know, scientists don't know that if warmer weather is going to eliminate the virus or just disappear, just like the flu disappears like at the end of March. But, however, that could still happen. We still don't know until that time comes. But like you said, in warmer weather, it's much easier for us to have social distancing because it's warmer, people are more outside, they're not congregated, so it does improve things. It will flatten the curve a lot better then.
But on that point, doctor, I read somewhere also online that, like in the desert, when you have high temperatures, the coronavirus does not survive. Is there scientific proof to that?
Not yet. So they haven't been able to prove that yet. As a matter of fact, they've seen where in different climates that the virus has continued to spread.
Like, do they have as many cases in Africa, for example?
The last I looked at the map, I didn't see many cases in Africa. So that might be something that they're onto. They may look at that and see and try to understand why. But they may also not have as many metal surfaces as we do, in developed countries.
That's true.
And they have a lot more social distance.
Yes, correct. So it's really not completely.
Speaking of social gatherings and keeping our distances, so many people canceled their weddings here in the Dearborn community, my son is one of them, and appropriately so because nobody wants to put others' lives at risk. Dr.Belal or Sergio, I got a question. Should one wear a mask to protect themselves, and if so, how should they put on or take off and dispose of the mask?
So,
go ahead.
So the masks are, the guidance from the CDC is that masks should be used regularly by the people who are sick because when they cough or sneeze, it holds those droplets in. It prevents those droplets from spreading all over the place. And then when you see healthcare workers, they have protective equipment and they use that mask. The difference is when they're using the mask, it's specifically fitted to their face, and they have to wear that mask all the time. So they can wear that mask for a couple, 2-3 hours, depending on their level of exposure, and then they, in a medical setting, have to go to a sterile area, remove it in a as a healthcare professional, using their techniques, and then put on a new clean mask. When a member of the public puts on a mask, especially those loose-fitting, like surgical masks, they don't prevent anything from going in. So they really don't have the effect of preventing somebody from getting sick that we, as a society, tend to think that it does.
By the way, I'd like to take this opportunity to thank all the doctors, all the nurses, all the healthcare workers who are on the front line fighting this battle, yeah. and I think they need to be commended, really. I mean, they go to work every day, and I've seen them. We have Congresswoman Dingell on the phone. Okay, so we're going to be talking to Congresswoman Dingell, and we'll come back and ask a couple of questions about is she on?
Sam, if I may,
yes, go ahead.
I just want to just add to Sergio's mask answer. So if you're not sick, just a kind of a summary of what he said. If you're not sick, you don't need to wear a mask. The only time you need to wear a mask if you're not sick is if someone in your household is sick and they're in self-quarantine. So if you live with family members who have the COVID-19 or have the symptoms and they're quarantining in the same household, then they should probably, number one, be placed in, they should remain in one room and also use only one bathroom if that's available, where no one else shares that bathroom. And if you enter their room, then you should wear a mask. Only if they can't wear a mask. So if they're sick, if someone is sick, you should wear a mask yourself if someone's going to visit you in your room. Otherwise, if you're not sick, you don't need to wear a mask. For the reasons that Sergio mentioned.
That's a good point. Yeah. Congresswoman Dingell, good evening. Are you with us?
I am, and I apologize. I've been on the phone with some of the auto CEOs dealing with some of these issues.
That's fine. Well, thank you for joining us, and I'm sorry you couldn't be with us, but we were talking about different aspects of this crisis. Can we call it a crisis, Debbie?
It's a pandemic, so yes, it's a challenging time for all of us, but we're going to get through it working together.
Okay. Debbie, what can you update us and the viewers on what happened in Washington with the bill that was passed and signed by the president? I know this has a lot of economic implications, a lot of self-employed people, business owners, small business owners are being impacted, from the barbershop to the restaurants to all the businesses. What can you tell our viewers from the economic standpoint?
So I'm going to explain what is going on and what is going to continue to go on. The first thing that we did in Washington was to pass an $8 billion expenditure to ensure that the federal government was investing in some research and making sure that we're developing the vaccine, and then we'll be able to buy vaccine for every American, to ensure that some of the healthcare issues that needed to happen, we still are not being on testing, to step up the testing efforts in other just direct healthcare needs. On Saturday morning, in the wee hours of the morning, we passed legislation that what the goal of this is, and I want to answer a specific question that came from Local 600,
yes,
is to ensure that nobody doesn't go to get a test for coronavirus because they can't afford to pay for it. So the first thing the bill did was to ensure that if someone has to have the coronavirus test, that it would be paid for, and that they don't not go to the doctor because it won't be paid for. The second thing that it is trying to do is to ensure that anybody who is sick gets access to emergency paid sick leave. So this bill will make sure that as many as 87 million U.S. workers who have no paid leave and are having to choose between that paycheck, their health, and the health of people around them. So the vast majority of these workers would receive full pay for 2 weeks or 80 hours. Now, what I have discovered and what the way the Democrats, and I'm not trying to be political, I think there's no room for politics right now. I think this isn't a Democratic virus or a Republican virus. It's something we will put together. But the initial draft of this bill had universal sick pay. The Republicans wouldn't agree to that, and we have to get both sides to agree to it because we've got to get this to people. So that the local 600 employees are covered because people who have, and you've got a union that negotiated this for you as part of the OEM coverage, you have sick benefits. It's budget. But there are people who have that basically will be doing a third tranche of legislation in the next days that of anybody that was left off of. 89% of large private sector employers, and it's the smaller and medium-sized employers that don't. So is one of the things that we are going to work with. I have been working with the UAW and the autos nonstop all weekend because, I want to say something to people that are watching. We need to keep manufacturing going in this country.
Yes.
We aren't going to have respirators or ventilators or masks or food to eat or transportation that we need if people aren't willing to work, and we need to thank them. We're worried about people at the restaurants and the smaller businesses who are losing their job, but we also need to thank, yes, the doctors and the nurses and the frontline responders, and they're critical, but the people that are in the plants need to know they're keeping the economy going in this country, and it would collapse if we didn't have the auto workers in there. So we're getting... Go ahead.
No, I'm sorry, Debbie. I have a question. Several people reached out to me. What can you tell the homeowners or the renters that are responsible for mortgage payments or rent payments or utility bills? Will there be some kind of a relief from the federal government where they don't have to make a mortgage payment for 1 or 2 or 3 months until this crisis passes?
So there's going to be a third tranche of legislation. Tomorrow, Schumer is going to introduce legislation that would address that. But in the meantime, so on some of these, tomorrow, the next bill that's going to be introduced will do a number of these things. So one of them is to, it's in here, would provide the loans and moratorium foreclosure. Some of the banks, people need to understand that this has just come so fast. Not because we shouldn't have done some planning, but we should have, and we eliminated some of the positions we shouldn't have. But, so for instance, both utilities in Michigan have said that they will not turn off utilities during this coronavirus crisis. So we know that, and if for any reason that somebody's utility, so that we are holding them accountable to they're not doing it, they should call any of us that are on this, that are at the Facebook or on the phone.
Yeah.
One of the banks are saying that they will give people a buy, but we are going to try and legislation, but we have to get the Republicans to agree to it. And I know that the state is looking at it, and many people are looking at it. Can it be done by executive order? So everybody knows with a heart that that's got to happen, and we're looking at it.
Okay. What's your final message? Okay, Assad Turfe, the Chief of Staff, has a question for you.
Congresswoman, I was going to make a suggestion. If they're going to pass legislation to let's say if it happens, to waive a mortgage payment for homeowners. Could you just pass along or make sure that it trickles down also to the renters for those that are renting properties to ensure that they get some kind of protection as well, or at least get, don't have to pay a rent payment? Because I think that's important as well too if that happens.
I don't think we can do that at the federal level, but
Yeah.
I think you and I together have to make sure that people are hearing it. Some of this is legislation, some of it, but we should also be, and when you talk about rent payments, it's not mortgage payments to be to banks. Renters pay to a variety of people, and you can't, we got to figure out how we can tell just you and see. Yes.
Yeah. We're losing the connection here, but I want to thank you for calling in today and offering your perspective, Congresswoman Dingell, and thank you for everything that you're doing in Washington. And stay safe, and hope to see you in 6 weeks. Right?
I want everybody to listen to what's being said. I am home. I am answering Facebook, office, postings, etc. Right now, we need to just listen to each other. We have had cases in Dearborn, and we just need to physically distance, not socially distance. We need to talk to each other. We need to check on people. We need to stay in touch, technology-wise. The technology that kept us for a while, maybe not having that human touch, we now need to use to have that human touch.
Okay.
Thank you, Congresswoman.
Thank you. Thank you.
Thank you.
Stay safe. Dr. Abdallah, one of the other questions that was sent to us, is it safe to receive packages from an area that coronavirus has been reported?
Currently, the World Health Organization and the CDC have found that it is safe to receive packages, that they're not at risk of having the virus on packages. So, to be on the safe side, if you're getting a package that's a non-perishable item, you could disinfect it if you want to, but it's really low risk and it's safe. So.
Okay. Another question,
Yeah, I'd
maybe
like to-
Sergio. Go ahead. I'm sorry, Sergio.
I
Go
just
ahead.
wanted to add to that with as scary as the coronavirus seems, as much as it's spreading and causing the COVID-19 disease, the virus itself is actually very weak. So it doesn't live for very long outside of a person, and almost any disinfectant will kill it almost instantly. And the CDC on their website does have a long list of disinfectants that can be used to kill it, but pretty much any disinfectant that says that it kills 99.9% of germs is going to kill it.
One of the questions that was debated back and forth, Dr. Abdallah and Sergio, is if a person is infected and they don't show symptoms, can they pass it on to another individual?
So, I've seen this where, for example, President Trump was shaking hands with someone who didn't have symptoms, but he got tested. He should get tested again, by the way, but that's just a side note.
Yeah.
So most people will have some symptoms. So whether it's a dry cough, a low-grade fever, and feeling tired, those are the main symptoms. But everyone will have some sort of symptoms. So if you're just feeling a little tired and you have a fever, you may not think that you're ill at all. Maybe it's like an old cold. However, during this period, you are infected. So you are shedding the virus, and you can infect other people. So that's why once you have these types of symptoms, that you should self-quarantine. And then if you feel like you may have the COVID-19 infection and you want to self-quarantine, so you stay home, you can call your doctor, get some advice, see if you need to get tested. But for the most part, you can stay home and just get over the illness, unless you're instructed by your doctor to come get tested, and they'll tell you how to do that.
Can any of you talk about testing sites? Can people, you see this all over the country, people drive through and they get tested. Is something similar going on in this area?
Yeah, it's starting to now. So, one of the most difficult things, as everyone knows, was this testing was very slow. And there's multiple reasons why it's been slow. The main reason is the CDC developed a method for testing. And every lab in the country can, on their own, decide to develop their own method. And as you know, everything has to be approved by the FDA. Well, during an emergency, they say under emergency, you don't need to be approved by the FDA. Then labs can then develop a method not FDA approved. However, during this time, the CDC found that there were some labs that were not testing properly, so they eliminated all that, and they said everything must go through the CDC method. And that's why it's been slow, that the CDC cannot keep up with the reagents needed to test everyone. Now, however, that's changed. Now, ever since President Trump called the national emergency, we do have not one, but now two. Today there was another one approved, two FDA-approved methods that every other lab in the country can copy and then test. So the private sector can now test for coronavirus as much as the CDC can. And now you'll start to see doctors' offices receiving kits from commercial labs and be able to test at a much faster speed. The drive-by testing that you're talking about are, yes, currently like Beaumont Hospital, for example, has a drive-by in Royal Oak. They have one in Dearborn. They have one in Taylor now. Those are, they were using the CDC method, and now they're using their own methods. So.
But not anyone can drive through and say, I want to get tested.
No.
They have to have symptoms, correct?
That's correct. And this is, another thing that I want to mention is if you have symptoms, don't go to the drive-through to get tested, because what that's doing is you're overburdening the hospital system with, you have mild symptoms. You don't need to get tested. You can go home, self-quarantine, call your doctor, and he or she will tell you if you need to get tested. So do not go into these drive-throughs because they're mainly for the really sick patients. And what the emergency rooms are doing with these testing is taking the patient out, screening them, and then putting them directly in isolation. And that takes time and resources. So we don't want to put everyone through that. Yeah. It's best to just stay home.
Doc, can I ask a question? Is there a possibility? So if someone's sick and they go to their doctor and they test positive for the flu, could they potentially have COVID also, or is there a way to have both viruses? Or, I mean, because from my understanding is they'll test you for the flu. If you're test positive, they stop.
Correct.
Okay.
So this is the way 99.9% of doctors, the healthcare functions is when you find a source of an infection, you treat that source. So if you find a flu, then you treat the flu, and you should recover. Now, it's really very difficult to have both at the same time because your body usually, the first thing that goes in is going to cause an infection. It is possible, it's not impossible. However, if you're being treated with the flu, for the flu, and you're staying home, and you do have a COVID co-infection, it'll be treated just the same way anyhow. You'll be home and you just have to then quarantine. They may then ask you to get tested at another time.
Okay. Before I ask Dr. Abdallah this question, as I want to come back to you, you mentioned something earlier about the measures that the county is doing, and something very important you said is protecting our personnel. And I think of the police officers, the Wayne County sheriffs, all the sheriffs that are on the street. If they get infected and they pass it on to their co-workers, that's a major problem.
It is. And it's something that's definitely been concerned about. I know there's definitely discussions at the federal level right now on how to protect essential personnel, first responders. It's definitely a concern of ours at the county, and we're definitely thinking about what measures needs to be done. And we're encouraging local municipalities to also come up with, protecting law enforcement officers as well, and EMTs and EMS, but it's definitely a concern. Most police officers, we're taught to take universal precautions, and one thing about an officer is that, over time you develop instincts, and you can't rely on instincts all the time, but you assess a situation, and if a person looks sick, keep your distance, and it is definitely something that's definitely of concern.
Yeah, because law enforcement people are out in the streets and they're protecting the public, so yeah, they could be exposed. I have a question. This is one of the questions that came in, either Sergio or maybe Dr.Belal. Can humans become infected from the COVID-19 from an animal source, or can they get the coronavirus from their pet?
So That's a complicated question because there's something called spillover, which is the virus originated in an animal.
Okay.
And then through spillover, which is contact with the animal, the person becomes infected. It's still not known yet. There's a lot of speculation. Was the first animal that infected a human, was it a bat or a civet cat? We don't really know yet, but there is a type of animal out there that carries it, contact with that animal can, if that animal is infected, can spill over. So the CDC and the WHO do recommend that if you have contact with those animals, that you hand sanitize, wash your hands after any contact, cook those meats thoroughly if you're preparing them as food. As far as an animal like a pet, like a dog being infected, there have been stories. So there have been news articles of a dog, I believe in Canada, that was tested positive for COVID-19. There's no indication at this point that a pet can transmit that to a person. So there are only certain animals that can actually transfer diseases to humans, and at this point, I don't want to say definitively that a dog can't do it, but it has not been proven that I'm aware of that a pet can do that.
We have some questions from Facebook. If you got the flu shot, does that help?
It helps against the flu,
Against the flu.
but not the COVID-19.
Okay.
However, I just want to add to that. It is important that people at risk do get the flu shot, because if they don't get the flu shot, you just have one more illness you have to deal with. So I recommend to get the flu shot if you haven't.
We're getting these questions. This is from Kim. And we have someone asking, has anybody in Michigan died from the corona? Muhammad is asking, has anybody in Michigan died from the coronavirus yet?
No.
Do we know that? We don't know that. Okay.
No confirmed.
Not that we're aware of, but stuff changes very quickly.
We have a question from Mandy. Can you get tested for free if you are uninsured? Very good question.
So, President Trump mentioned everyone can be tested for free, right?
Yeah.
We just have to figure out how they do that. But everyone can get tested if they have the symptoms and the need to get tested. And I think we'll just worry about payment, whether it's the hospital or the doctor's office at a later time. I'm sorry, what was the second part of that question? It was important.
If you're uninsured, if you can get tested.
Yeah, and I can tell you, my colleagues, many physicians in the area, in the Dearborn community, have come together and helping each other, and a lot of them are moving towards telemedicine, and many of them will start as right now we're kind of putting the telemedicine together, but once that happens, I think a lot of them will reduce the interaction between patients, as well as for people who are uninsured. I know, in my practice, I haven't done it yet until I get telemedicine implemented, but maybe even, just a minimal charge, just so that they can get on the phone, let me know what they have, and decide whether they need a test or not.
We got two more questions, Doc. This is from Muhammad Abdallah. Are there any benefits to wearing gloves when you go out?
Again, it's like the mask question. So you can wear gloves and walk around with gloves, but now you have the gloves on, and they could be now
become contaminated.
They're contaminated. So you have to figure out, okay, when do I take them out? Yeah, so you got to take them out before you go into your vehicle, because you don't want to bring them in your car. It's for if you're going into your loved one's room who is sick, and you want to clean it, then that's a good time. You go wear gloves, you clean it up, and then you take off the gloves and throw them away. We
have one more question before we wrap up with final comments. A question from Sam. Does zinc or vitamin C pills work? Do they help?
So zinc and vitamin C are two things that I would recommend in order to help build up your immune system to fight any virus, whether it's COVID-19 or any other virus. So I would recommend that. I wouldn't recommend it in more than the recommended doses. And the things that really will help you not get as infected or as sick is a good healthy diet, exercise. You can take the vitamin C and zinc. Don't overdo it with those things, but and stress. So don't panic. Stay stress-free, and that'll help.
Okay, we're going to wrap up here with final remarks. Assad, what would you like to say to our viewers?
I just want to say we're going to get through this. We've got through this. We got through many things before. We just got to take a deep breath, relax, and just remember there's a lot of misinformation out there. And at the end of the day, the overall death rate is 2%. I always think a worst case scenario. I still like my odds, but, just we need to be practicing social distancing and everything is going to be okay. Yeah.
Sergio, final thoughts.
So for my final thought, I'm going to steal something that Assad said earlier and kind of double down on it, which is that in the United States, we have a sort of a hero mentality that we look to first responders, police officers, firefighters to save the day, the whole Marvel comic type of mentality. And this situation is completely different. This is not a situation where a hero can step in from outside. The heroes are going to be the residents, the members of the community, the moms and dads and the kids who take the time to wash their hands. They remember to stay home from work if they're sick, sneeze into their elbow. It's the people who need to work together, to come together, to protect each other. There's no outside superhero that's going to save us. We actually need to rely on each other.
Dr. Abdallah?
And just to add to that hero, you are the hero. And the way you are the hero is if you get symptoms, you stay home, quarantine for 14 days, and you're a hero because you did not spread that virus. And once you do that, we go back to flattening that curve. So if you get symptoms, and especially at this time, even if it's cold symptoms, leaning towards the COVID-19 symptoms, just stay home 14 days and you're a hero.
Thank you. I have a couple thoughts I'd like to share. Many business owners now are accommodating senior citizens. They're having special hours for them to shop, like from 7 to 9 in the morning. And my message to the community members, make room for the senior citizens. Let them go out and shop without being fearful that they're going to get this coronavirus from other people. And the last thing I would like to say, and this is to the doctors, the nurses, all the healthcare workers that are fighting this on the front line, thank you, thank you, thank you. Thank you everyone for tuning in. Thank you, Hassan. Thank you, Dr. Abdallah, Sergio. Thank you, Assad. And thank you, Congresswoman Dingell. And stay safe, everyone.